Let's talk about some signs that are in your menstrual cycle that could be telling you that pregnancy will be difficult for you. Maybe you're not married yet, and there are some abnormalities in your menstrual cycle that you may not be taking seriously, but these signs are indications that you will have a hard time getting pregnant. That's what I want to show you. Number one is irregular menstrual periods. When your period is irregular, maybe it comes today, next month it changes, the other month it will change, or your cycle length is very long, you will find it difficult having an ovulation. Research has shown that women with very long cycle length, most of the time they do not ovulate. So if you don't see your ovule, there is no egg release, there will be no pregnancy. So if your cycle length is long and you are not married, my dear, you still have time to make things right. Go and meet your doctor. Work with a fertility physician who can take care of this thing for you, so that when you are ready to have your children, it will not be a problem for you. Number two is heavy menstrual period. When your period is very heavy and lasts for a longer period of time, let's say between 5 days and 8 days, it could mean that pregnancy will be difficult for you. The reason is because there is a condition called endometriosis. This condition is when the inner layer of the womb starts to grow profusely, out of control. It even grow out of proportion from its own place. It will grow outside into other organs. This can be very painful. Most women that have severe menstrual cramps have what is called endometriosis. So if you have heavy periods that last for 5 to 8 days, then you are likely to have this condition. Go and meet your doctor so that you two can work together to find your way around it, so that when you're ready for your pregnancy, you will have no problem. Number three is absence or complete disappearance of your period. Sometimes some women who are not yet in their menopause will report and say that their period has suddenly stopped. For several months they've not had a period, and yet they are not going through menopause. A lot of reasons can be responsible for the disappearance of your period. So if for any reason your period disappears on you, get a certified fertility doctor to check your body, carry out some investigations, and make sure that they find your period back for you, so that when you're ready for pregnancy, it won't be as difficult as it would be if you do nothing about it. The last one is facial hair and hairs on the chest. This facial hairs should not be taken for granted. This hair indicates a condition called PCOS, polycystic ovarian syndrome. This condition has to do with hormonal imbalance, also has a connection with insulin resistance. Okay, so if you have this condition, insulin and hormonal imbalance are two factors that can grossly affect your fertility. Okay, so PCOS again on its own is a condition where the eggs do not mature. Do you understand? The eggs do not mature. The eggs are filled with water. So fertilization cannot occur most of the time, even if you are ovulating. Okay, so it is important that if you have facial hairs on your face and your chest, go and get a certified fertility doctor who will diagnose you properly, place you on treatment that will help you, so that when you're ready for pregnancy, it will not be as difficult for you. Please, if there's value in this video, kindly share with someone you know. You may be saving a life. I will see you in my next video.